With some of the nation's highest rates of poverty and chronic illness, the debate over improving health care coverage and access remains a critical issue in Mississippi. In this final installment of Bill of Health from the Roy Howard Community Journalism Center, Morgan Gill takes a closer look at the potential consequences and solutions lawmakers may consider as they head into the 2025 legislative session.
Mississippi is one of 10 states that has not expanded Medicaid. This decision continues to affect access to primary care in a state where nearly 2,000 people rely on each primary care physician. Although some see this as a call to action, opponents argue Medicaid expansion may not be the answer.
The original intent was not to be this mass health insurance, government-run health insurance. And so adding more able-bodied individuals into Medicaid and putting them in there into a system that's already overloaded, has its own broken pieces, and then allowing those individuals to come into the system, we think will further diminish the help that people who its original intent would have been for.
Starla Brown, the state director for Americans for Prosperity, is one of the voices opposing Medicaid expansion. She warns expanding could strain both federal and state funding. Governor Tate Reeves has also rejected the idea, stating, "Adding 300,000 able-bodied Mississippians to the welfare rolls, I would argue, is a bad idea." Brown and other critics support moves that focus on private insurance solutions and reducing government involvement in health care.
We hope, as Americans for Prosperity, that we can look at a series of reforms under the personal option, whether it's at the federal or state level, things like certificate of need. We hope that we can enact these laws and this legislation, and when you add it all together, the outcome can be more access, more affordable health care for all.
The personal option proposes expanded telehealth, reduced prescription costs, and reforms to health savings accounts. Brown argues this approach provides patients with more choice and less reliance on government programs. Proponents of expansion, however, point to states like Ohio and Arkansas, where Medicaid expansion is credited with reducing uninsured rates and narrowing racial disparities in health outcomes. Hospital Administrator Richard Dodrell cautions once Medicaid is expanded, it would be difficult to reverse and could cause strain on the state for years to come.
Well, once you start an entitlement, you can't take it back. Where's Mississippi going to come up with the money?
I'm Morgan Gill, reporting for the Roy Howard Community Journalism Center.